started.
All right, good afternoon, everybody. I'm pleased to kick off the Fall 2014 Virtual Seminar Series with Dr. Joe Trainor. Dr. Trainor is a 2002 Millersville alum and an assistant professor in the School of Public Policy and Administration at the University of Delaware. Dr. Trainor conducts research, provides consultation, teaches, and mentors students. He also conducts multidisciplinary mixed methods, qualitative and quantitative research focused on different dimensions of disasters and crises, some of which include international aspects of disaster, disaster research and practitioner integration, warnings, risk perception, household insurance and mitigation decisions. Dr. Trainor's findings result in over a dozen peer-reviewed articles and book chapters and over a dozen disaster-related reports and invited publications, theses, and dissertations. Dr. Trainor has international experience, has worked on projects with collaborators in India, Sri Lanka, the Netherlands, Sweden, Japan, and Australia. He's particularly interested in exploring how different cultures, settings, impact, human interpretation, and response to disasters, how different places approach the management of risk and disasters. Without further ado, I hand it over to Dr. Trainor.
Hi, everybody. I want to check and make sure the audio is working fine. I was having an issue. I had to do some setup here.
We can hear you loud and clear.
All right, great. All right, wait, so we've got a couple people here. I see some people I know. I see Tim Sevens is on here. He's actually part of this project that I'm going to be presenting on today. So to say welcome to everybody. You have to bear with me a little bit. The platform is new to me, although I do quite a few kind of conversations on virtual platforms. This particular platform, Blackboard, is new to me. So if there's issues, you'll have to forgive me. I'm going to do a conversation here, a talk here I think should be kind of interesting. It's a book project that was funded by FEMA, particularly the FEMA in Higher Education program. For those of you that don't know that program, basically the program is focused on creating curriculum and material to help people in emergency management programs. So it's to help both professors and students kind of bring together some of the core ideas and core knowledge. So they commissioned this particular project to develop a textbook that Tony Subio, thought would be a good idea, and this is the results from that project. The project went on for about 2.5 years. Just wrapped up this at the middle of this year, and the results should be available. The actual text, the document itself, should be available from FEMA probably in the next month through their online open source channel. As I'm talking, if there are questions, I'm not sure. I'm assuming everybody has the opportunity, has the ability to kind of chime in with voice. If not, to chime into the chat. I'd be glad to answer questions along the way. Don't feel like you have to just absorb. I'm game for a dialogue if you're interested. So basically, this project, the concept of the project is pretty simple. The idea is that if you look through the research and you look through the literature, there's a huge amount of discussion of the divide between academic and practitioner views on emergency management. And I find that problematic. I find it actually really to be a problem. I think it's an issue. I think that a lot of the conversations in the research community and conversations I have when I'm at conferences, they show kind of a lack of understanding of either side. So academics have a lack of understanding of the real world life of a practitioner, the life of someone who's trying to kind of implement plans and policies and handle agency responsibilities. At the same time, I think a lot of times practitioners have a limited understanding of what a researcher or an academic actually does. And what happens then is that both sides end up thinking about the other as a caricature, right? So it's this cartoon that exemplifies all the problems with the worst version of a practitioner or the worst version of an academic. So what Tony and I decided to do, and Tony, who is my collaborator, co-editor on this project, who also is a graduate of Millersville. Actually, he graduated from the master's program in disasters at Millersville, and we came across each other. We bumped into each other really at a 2008 or 2009 Pennsylvania State Emergency Managers Conference. He was there representing the agency, representing his local jurisdiction at the time, and I was representing the Disaster Research Center at the University of Delaware, doing some presentations on how people respond and react to warnings. And we ran into each other. We said, "Isn't this crazy how everybody kind of disregards what the information or the knowledge that the other side has?" That, you know, academics say, well, you know, if it didn't come from a study, if it wasn't a systematic sample, if it wasn't all these things, then that it's not really valid knowledge. And at the same time, we had practitioners that are saying, well, look, if you weren't boots on the ground, what do you actually know? Right? Get out of the ivory tower. Just because you read it in a book doesn't mean that it really happens that way. And we said that's really problematic because both sides know something. Both sides have seen things. Both sides have experiences, and actually, for the most part, we think that these are different perspectives or different views. They're different ways of coming to understand what's going on. So we decided, well, what if we brought those groups together? What if we focus them instead of allowing people to kind of talk about caricatures? What if we really focused and forced people to work with each other on specific problems and kind of really learn about each other? What might come out? So basically, we had this idea: practitioners. These are the folks that implement emergency management programs at the federal level, the state level, local levels. We're talking about people that do business continuity. We're talking about people that work in school districts and hospitals, but basically the people that are primarily responsible for implementing emergency management plans, policies, and procedures. Academics, on the other hand, are the people that typically study emergency management, teach emergency management. That's their primary affiliation. So typically in higher education settings, labs, consultation in some settings, although consultation kind of crosses over. And then there are a number of government agencies that have research or academic arms. And then, of course, in the real world, these are not kind of strict categories, right? There's a lot of people that cross over between the two. So oftentimes people would say, well, I'm not a practitioner or academic, I'm a pracademic. or although there's fewer of them, I'm an academicianer. So the idea is that there are some people that cross over, but for the most part, people tend to see themselves as one or the other, or at least to have a primary affiliation with one. So I'm mostly a practitioner, but I have some academic experience, or I'm mostly an academic, but I have some practical experience as well. So what do? We said this us versus them attitude is not good, it's not productive, it's not helpful, it doesn't do anything to advance emergency management. And I think, so in all truth, I am much more academic than I am practice. I've been to a lot of disasters, I've done a lot of work at disasters, I've worked with a lot of government agencies, but I'm not typically the one responsible for implementing the policies. It's more an advisory role or a consulting role. But even in the academic literature, there's this problem where we talk about things like new degree programs and how it's such a great advance over what's existed before, and it kind of sets up this idea that something was wrong with with the way things have been, and I think that kind of undermines the development of emergency management in the practice community and all the things that have gone on to make it stronger and improve over time. So again, the idea here is that this us versus them attitude is just, it's not productive, and it doesn't help anybody. We don't share information that way. We don't learn from each other. So the idea was to start a dialogue, develop some new ideas, but to kind of focus in on some of the things that are actually creating this divide or this perceived divide, and then try to bridge it some. So again, FEMA funded this project. Tony and I are co-editors, and we sent out a whole bunch of recruiting information. So we put out information in a number of academic outlets, conferences, International Association of Emergency Managers. We sent it out to Facebook groups and LinkedIn groups, and we basically asked people in practice and people in emergency and in the research community to submit to us a one-page draft of an issue that they think is critical in emergency management, a problem that they think really matters, that really needs discussion. From those, we got about 130 or 140 submissions, and Tony and I went through all of those submissions. We did a little research on the background of the people and their history, and we selected a group of 12 issues that would be focused in this volume. And basically, we selected them because we either saw a good team that was made up of an academic and a practitioner, or we saw an academic and a practitioner who had separately submitted ideas to talk about the same issue, even if they hadn't known each other beforehand. So basically what we did then is once we selected those authors, we invited them to participate, and we had each write an individual summary. So the academic wrote an individual summary, and the practitioner wrote an individual summary of whatever that issue was. So Tim, for example, who's actually on this call here, was part of our NIMS discussion, and wrote a section on the state of practice around NIMS. So what did we do? We had the two sides write these documents, and they submitted them to Tony and I. Tony and I then read them, reviewed them, sent back a set of comments to the authors. We also forwarded their initial drafts on to their counterparts. So the academic got the practice paper, the practitioner got the academics paper, and we asked them to provide a 5-page response or critique or discussion of what they saw. Those were pretty interesting. Some people were very critical. Others were more kind of light editing. Others were downright argumentative. So, but those exchanges between the editors and the individual authors kind of created this basis for a more extended conversation. So then we sent back the reaction papers, the edited versions of the initial drafts, and we sent them back to the authors and told them that they had to revise and adjust their initial submissions, but then they also had to respond to and collaborate with their counterpart and produce a section that we called Bridging the Divide. And these were not supposed to be just consensus documents. They were supposed to identify consensus and conflict and points of agreement and points of disagreement, places where we could change practice immediately, places where the research had holes and gaps. So the idea was that we would do something more we would try to understand the state of practice and the state of research around that particular issue. The authors in many cases went back and forth on those for a number of months. Again, some folks working really well together, really collaboratively. Others really probably will never talk to each other again after this. but they I think in every case, the chapter, what resulted, despite the conflict, has valuable insights and useful understanding for us. So it's not. I want to stress that the value of this volume is not that people agreed; it's that we understand more about where we agree and disagree. So once we had those documents, we sent them out to peer review. For those of you that don't know the peer review process, I think most of you should. But basically, what that means is we sent the full draft of the chapter out to one academic and one practitioner. And then the two co-editors, Tony and I, also reviewed them again. We synchronized all those comments and sent them back to the authors and asked them to react and reflect on that, so that they wouldn't have to do exactly what the reviewers said, but they had to at least respond to those reviews with a logical kind of argument and discussion. So that's the way the book process worked. So in terms of what we actually had, we had a number of issues that we talked about. Basically, when the volume is released this month or next month, you'll see a number of interesting topics. The first one is state, local, and federal relationships. This chapter focuses on the implications of a whole community philosophy for how we govern emergency management. The argument is, if we really embrace a whole community perspective where people and local jurisdictions and state jurisdictions and federal jurisdictions have to share responsibility and share resources and share role, what does that mean for how we structure the programs? So some interesting theoretical and applied conversations about the relationship between the different levels of government. And there's a conversation about volunteers and nonprofit organizations. Primarily, this conversation focuses on unaffiliated volunteers and how to utilize those volunteers on the site of disasters. So their strengths, their weaknesses, some kind of concepts about what works and what doesn't work, and then some ideas on where we might go. The next chapter is on private sector integration, and this is, I think, an particularly interesting chapter where there's conversations around what does it mean to be a private sector and part of emergency management. So not just a contract kind of relationship. What does it mean to really engage with private businesses and have them connect? Then we have a chapter on access and functional needs populations, and this is a discussion of what used to be called at-risk or special populations, a concept that's evolved over time as some federal case rulings have come down about access and functions, and some ideas of access and functional philosophy have shifted. So this looks at how, particularly in the context of sheltering, but across the spectrum, how we're dealing with access and functional needs issues and the provision of access and functional needs assistance during disasters. We've got a great chapter on public health and emergency management. I think a lot of people know this, but public health and emergency management have kind of come together recently in ways that historically they haven't. So what do we mean by that? We mean that we are seeing public health engage much more distinctly and directly in emergency management functions, or functions that we used to think of as emergency management, and vice versa. We're seeing emergency managers drawn into things like H1N1 and swine flu and bird flu and the respiratory diseases. So there's a lot of discussion about what do we know in public health that's related to emergency management, both in theory and in practice. Great chapter also in the book on planning and improvisation. So what is the relationship between plans, policies, protocols, and the kind of off-the-cuff, moment-by-moment adaptations to situations. Chapter on the National Incident Management System, focused on what is NIMS, what do we know about it, what research exists, what's happened in terms of trying to implement NIMS. So again, this chapter Tim Sevens is on the call. He's actually on this call here. Was a co-author on that chapter. Actually one of my favorite chapters in the book. Hold on one second. Sorry. Then there's also a discussion of long-term recovery. So most folks would know that the long-term recovery plan, planning guidance, came out a few years ago. There's been a lot of evolution, particularly post-Sandy, post-Katrina, post-Sandy, of recovery policy, recovery planning, and approaches to recovery. So there's some discussions of the long-term recovery process, what exists. Exercise and evaluation, so particularly looking at the after-action reporting and the HSEP programs. So how do we evaluate how we're doing in exercises, and how do we evaluate how we're doing in terms of preparation? There's a chapter on social media. So the idea is, there's a lot of conversation around the internet, around Twitter, Facebook, all these platforms that are out there and available now. There's a lot of excitement over the potential or possibility of those programs, but we just don't know how to use them. We're just not sure how to leverage those technologies. So there's been some discussion on how to make that work. What do we know? What's been done? And that's a great kind of progressive chapter. Talks about a lot of barriers and facilitators of using social media in emergency management. And then the last two chapters are a little bit more conceptual. One is the evolution of emergency management as a profession. So how has emergency management gone from what used to be, even 10, 15 years ago, a third responsibility for one person in an agency, to a much more meaningful and comprehensive it's a job. It's a space for a person who sees this as their complete career rather than just an additional duty as assigned. So the idea is, how is that idea of an individual independent profession with its own philosophies and principles separate from EMS and military and other kinds of related disciplines evolved over time. And then finally, there's a discussion on neglected issues in emergency management. And this is reflection of both an academic and a practitioner who've been in the field for the better part of 20, 30 years, reflecting on things that they've seen come up again and again and again that seem like they're hard to deal with, they're hard to adjust. So again, this presentation, so I've already been talking for 20 minutes here. This presentation is not going to focus on the substance of these chapters. It's kind of a shame that I don't have more time and I couldn't do that. There's a lot of great information in these chapters, a lot of really cool, important insights that I think are of value and worth looking at. As I mentioned, this book will be available on the FEMA and Higher Education website under the textbook section, probably by the end of this month, maybe the end of next month at the very latest. So the volume will be free of charge. It's in a web downloadable PDF, also and searchable table of contents. It's a good finished edited volume. So I encourage you to kind of take a look at the substance of it and these particular chapters, especially the ones that interest you. But what we're going to talk about today for the rest of the time actually are insights that Tony and I developed over the 2 years that we moderated this process. And it's really interesting, I think, because Tony and I, every time we got together, had an opportunity to talk to each other, spend a lot of time together, and realize the differences that we had in our basic understanding of what emergency management was, about what's going on in emergency management, about what's important. So we really learned a lot from each other, and we also learned a lot from mediating, and in some cases even adjudicating the relationships between the contributors. So again, as I said, in some chapters it worked really well. People were really friendly and excited and loved working together. In others there was significant conflict and there was a lot of tension. Some of that was driven by the content. Others were driven actually by personality and personal differences. But Tony and I, we sat down across the process and we took a lot of notes and jotted things down, and we wanted to identify some of the kind of key features of the academic practice divide, some of the things that we think are keeping people apart, that drive wedges, and we also wanted to identify some opportunities or things that we could do to bring the two groups together and have more sustained interaction. So there's just a couple things. The first thing, there's some kind of fundamental or underlying assumptions or things that you have to bring to interactions between academics and practitioners if it's going to have any chance of working. And the first of those, I think, is to value knowledge. This might be a little bit deep or a little bit of philosophy here, but I think there's a tendency for practitioners to undervalue research in terms of the way that because it's conceptualized work, because it's research method work, because it's kind of detached and abstracted. At the same time, academics tend to undervalue lived experience. So we want both sides to kind of recognize that these different approaches to knowledge, or these different ways of learning about things, that's exactly what they are. They're just different ways of learning. They're different ways of knowing. One is not fundamentally better than the other for a specific context. It doesn't mean that people don't know something because they didn't come to that knowledge the same way you did. So we're trying to encourage people to, instead of reacting and to the problems, to actually kind of grab onto it and say, what's the nugget here? What's the piece of information? What's the insight that I wouldn't have had if I hadn't had this conversation? So again, understanding this knowledge and different types of contributions. The next thing you've got to recognize is there are multiple divides to overcome, and I think this is really apparent to us. The divide is not just academic and practitioner. It's different agencies, it's different states, it's different regions, it's different disciplines in academia, it's different methodological approaches, it's different views on how to prioritize. There's lots of divides and in some ways when we were seeing reviews and we were seeing conversations, they were reflecting those kind of divides just as much as they were reflecting the difference between academics and practitioners by themselves. So again, it's important to recognize that this is not the only divide, it just happens to be the one we focused on here. All right, when we start talking about some of the things that separate or divide us apart, one of the things we noticed about how knowledge is created or how value for knowledge is created, in the practitioner community, what we tended to see is people who believed in their own experiences. Again, we mentioned this. If it's boots on the ground, if it's something you did yourself, if it's a program you implemented, then you know something of value. And then there's a tendency to kind of extend that out one step to a circle of people that were your trusted network. And that might be locally, or it might be an agency, but again, if it was someone you knew who did it, or you did it yourself, that's where the value for learning came from. That's where all the real useful information and knowledge came from. Academics, on the other hand, tended to devalue those individual experiences and say, look, they're only useful if we embed them in a broader scientific process. So if we sample all the kinds of people who have all different kinds of experiences, right? Or if there was a lot of emphasis on logical patterns, and when I say logical, I don't mean that in a judgment way. I mean if, then, or statements where we're really directed specific kinds of expectations. And then also academics, it was all about research, right? So what does the research say? What is the broad pattern? If we took all those experiences and cut across them, what do we say? So if it wasn't research, it wasn't valued on one side. If it wasn't experience, it wasn't valued on the other. Again, we think these views on knowledge are kind of fundamentally separating emergency managers and practitioners in a lot of practitioners and academics in certain settings. Also, the expectations for knowledge. This is something, again, that we hadn't kind of envisioned earlier. But when we saw in a lot of settings when people were reviewing documents and looking at writing, on the practice side, people wanted specific, actionable insights, right? So it didn't matter if we knew how people perceive a risk. If there wasn't a direct conclusion that said, given this is the specific program or policy or approach that should be changed. There was a lot of focus on causal analysis, so what created the incident or problem to begin with. And then there's also a lot of discussion, what is the value or importance of this insight for my specific jurisdiction, right? So if there's something that's different or unique or doesn't fit with my setting, then that's information that's really not useful or valuable for me. Same thing in the academic side, there wasn't a recognition of the specific ways to implement policies or implement insights for policies. So there was a lot of discussion on the context of situations. So here's the situation, here's the example of XYZ practitioner doing something, and here's all the complexity around it, and all the questions are focused on testing some theory or some concept. It's not looking at the details of the situation, it's really using that situation as an example of some kind of more abstract idea. So so again, that focus on the abstracted elements versus the detailed, focused, what can I do in this particular moment, was another thing that tended to divide people. Conflict, again, during different expectations, right? So what information has value? We already talked about this a lot, but also how you support information, right? So when someone would make an assertion, we know this. For the practitioners, it came primarily, the support for what people knew came from their own experiences or a good anecdote, a strong illustrative anecdote. So here's an example where I know this really happened this way. For the academics on the other side, everything had to be cited. So anytime there was an assertion of fact or truth or value, they wanted a citation to a previous work. And in some instances, people would make a suggestion. They would cite 10 or 13 studies that support that. A lot of our practitioners thought that was excessive. It wasn't really necessary, especially if you weren't providing details on the specifics of that information, of each one of those insights, right? So for the academics, all those citations were just evidence of a broader concept. For the practitioners, they wanted the details from each one of those cases so they could decide whether it was useful or not for their specific location or jurisdiction. So again, it's getting down, looking at how specific experiences relate to broader patterns and how broader patterns are relevant to specific places and experiences. And I think the more we're able to kind of make those connections from broad to specific and specific to broad, that's really going to facilitate the exchange between academic and practice. Another thing, so we talked about this need the relevant details for practitioners. We didn't talk about the academic side of this. Academics also had a problem with these kinds of passive references, where there's this assumption in academia that you either know the study that's being cited, or if you don't know it, you can go get it. And this is really not true for many of the folks in the practice community. Access to the journals and papers and articles and insights is really not that easy to get to if you're not affiliated with an institution that has these big subscriptions. So again, having that expectation that people could get all that other source information and had the time to read it and process it, it was creating a problem in the divide. Again, talking about the generalizability of information, academics were looking at a lot of, when they were drawing conclusions from studies, they were really focusing on all the variations and differences and little differences in details and problems. And there was a real hesitation to draw conclusions about how one specific study could or couldn't inform practice on something else. A lot of discussion about findings that were tentative or initial. There was this hesitancy to kind of make the bold or aggressive statements that really could be implemented in practice. Even in cases where there was pretty significant evidence that there was something that could be said, there's this hesitation built into the way academia does work, this difficulty or hesitation to really assert strong findings, strong conclusions, definitive answers. On the practice side, there was a willingness to accept more limited information and apply lessons from other situations in the context, because at the end of the day, there had to be a plan, there had to be a policy, somebody had to do something. There wasn't the opportunity to spend decades kind of thinking through it and wondering. You had to have a best solution. Even if the information was imperfect, if it got you one step closer to a better solution or a better problem, it was an advance over whatever had existed before. So people were willing to accept kind of impartial, incomplete information with a little bit more of a willingness, because it was maybe it brought things a little bit closer to, or improved it. It was some kind of evidence to an improvement, where especially in cases where there wasn't a lot of information available. Another interesting thing in conflicts of expectation is the shelf life of an insight. For many of the practitioners, there was a lot of discussion where old citations had no value. And this is really interesting, because in academia there's a tendency to see the absence of old extended historical citations as evidence that you didn't do your homework, as if you didn't study and gather all the information that you should have. So most academics, when they do a literature review and they're discussing the state of knowledge, they'll go back decades, 50, 30, 40, whatever, a long time back into the history of thinking around a topic in order to talk about how that idea has evolved over time. On the practice side, our practitioners were much more critical of literature and recites and insights that were more than just a few years old. Matter of fact, we even had some folks, so the review process was going on in 2013. They were looking at citations from articles and analyses written in 2010 saying, so much has happened in the last 2 years, how can any of this stuff be relevant given all the shifts that have gone on in the last 2 years? So there's a real disconnect between what's valuable or useful from older historical studies and analyses versus and trying to connect those to policy changes and shifts and adjustments that are happening right now. So again, another important conflict and expectation. We mentioned this before. There was a lot of barriers to implementation and sharing of insights. One of them was a real lack of agreed upon terminology. And I tend to be one that shies away from uniform and forcing people into strict use of terms and concepts, because I think there tends to be more that discussion and disagreement sometimes leads to important insights. But one of the problems we had here is that people were talking past each other pretty frequently. Different groups within academia and practice, and even especially between academics and practitioners, were talking about things in very different ways. And I think research is one of the real examples that sticks out here for me. For the practitioner community, the folks who were saying we were doing research, what many of those folks meant is they had gone to the internet and done kind of an internet search on other people who and found a policy or two policies that were relevant to what they were doing or relevant to what they're saying. Where on the academic side, research is a very strictly controlled set of processes and procedures on how you get information and how you look at that information and how you take it apart. So when an academic says they're doing research, they're talking about a really extensive and detailed process. Or when a practitioner said they were doing research, what really they were talking about is doing some kind of looking outside of their own agency or their own policy. So what they really meant by those terms were dramatically and drastically different. So when a practitioner said I did some research on something, an academic would say, well, you didn't really do research, or when a practitioner sees an academic say they're doing research, they're saying, well, I do research too. It's just like what you do. So again, there's a lack of understanding about what the other person typically does or can do or has time to do in their daily life. Again, we talked about this already, but limited access to platforms and places to share knowledge. So for academia, the journals are everything, right? People publish in journals and books, but those journals are super expensive and hard to get access to if you're not part of a university or affiliated with some kind of formal setting. Practitioners tended to like newsletters, but academics didn't publish in those newsletters or didn't interact and read those newsletters. So, well, there was this lack of conversation between. Again, authorization, this is an interesting example. While we were doing this process, I actually became pretty interested in after-action reporting and lessons learned and how agencies kind of develop their understanding. So I applied to get access to the lessons learned database that FEMA manages, and actually was rejected. I was denied access to that database on the grounds that I was just a researcher, just an academic, and had no need to really understand what was going on in terms of lessons learned in the practitioner community. So again, these idea that my knowledge is restricted and your knowledge is restricted, and we don't have platforms or places where they can really be exchanged, it's really creating problems. And then the conferences that we attend, typically academics and practitioners don't attend the same conferences. Academics go to their professional conferences that talk about theories and research, and practitioners go to the International Association of Emergency Managers or the local state emergency manager conferences. And there's not a lot of opportunity for that cross-fertilization, for those exchanges of ideas. So one of the things that we really had a discussion is it's really important for reaching out across, that people attend across these kinds of areas. Other interesting idea is that conflicts due to the nature of the work process. We saw some really interesting things between the way academics and practitioners even saw the work we were doing for the book. Academics tend to work on a grant type model of work productivity, where, and it's interesting, but it's very different from the way things work in the world of practice or business or consulting. So on a research grant, you have a good idea, a set of processes you promise to do, but there's a recognition that science is messy and dirty, and sometimes things don't work out that way. So a lot of the reporting and grant process, they give a lot of leeway to the people doing it. If it didn't work out exactly right, if you had to make adjustments or calls, as long as it's documented in detail, that it's fine. And they give a lot of leeway to academics to kind of decide when the product is ready and done. On the practitioner side, the practice world doesn't allow that kind of space. Reports are due when they're due. Projects are due when they're due. There's much more firm deadlines. There's much more control and oversight that needs to be done, or that is done within those settings. And it kind of created a tension between the academics and the practitioners, where the academics were far more concerned about the quality of the product over the deadline, and they were willing to miss deadlines, to push them back. Give me one more day, give me 2 more days, I need, in order to get it just right, where the practitioners were much more concerned about, look, there's a deadline here, we've got to meet the deadline. You ran out of time, it's good enough, we've got to move on to the next thing. And because those two approaches really reflect what's normal or typical in that line of work. And there are really important differences in how we approach problems that also kind of cause some conflict. So under the bridging the divide, so what do we do? What do we do about this? Some of these may seem pretty simple. Some of them may seem pretty obvious, but we're going to state them anyway, or restate them anyway. The first thing is relationships. One of the things that we noticed is that even for the groups that started out with tension, the more they worked together, the more they exchanged with each other, the better they were able to kind of find where the insights were. It's creating opportunities for those kind of relationships to evolve, and we think this volume did that for our contributors, and we really want to find more ways to create forums and spaces for those relationships to evolve. The next thing is improving access to information. Academia needs to do a better job of translating research findings into their applied outcomes or applied values. We need to show where some kind of basic science insight can intersect with or inform how a specific policy or a program gets implemented. It can't just be, this is what we know. There's got to be more so what statements. At the same time, in the practice community, there's got to be a willingness to engage with academia and discuss some of the practices and policies and give information on what's working and what's not. So willingness to participate in research projects, willingness to open up databases, at FEMA or state levels, where we can help do analysis of patterns in programs and policies. Again, this translation of research into practice is important, but also this discussion of problems in practice translated back into new research. So one of the things that happens a lot of times, academics create studies in isolation without knowing what problems practitioners are actually facing or issues that they're facing. So if we can better align the research questions and the search for kind of information with the real problems that people are facing, it automatically makes those findings more useful and helpful. We also think that there's some divides because research is such a specialized way of creating knowledge, because the processes and procedures and the language is so specific. Academics need to do a better job of helping practitioners understand research. We get this a lot. If you would just speak in plain language or plain English, if you would talk about these things in a way that wasn't so convoluted, it would be so much more helpful. So again, practitioners need to help researchers have to help practitioners understand the research, but there also has to be kind of an education here to elevate the ability of the average practitioner to read it and process it on their own. So again, a give and take there as well. Improve understanding each other and their daily kind of works, and then again, as I mentioned, opportunities for more meaningful exchanges. So what's the long and short of it? We think this particular volume has a lot of useful insights. There's a lot of information in it. We've learned a lot about the divide between academics and practitioners. There's a lot of cool, interesting, substantive outcomes that have come out of this. Ideas that either the individuals likely would not have been able to come to had they not worked together. I think that's really the takeaway here. These issues are not things that we can't overcome. There's a lot of potential in doing this kind of thing, and this volume is kind of evidence of the potential that exists out there if we force this divide together a little and kind of start bridging things a little bit more. So that's kind of the quick, although it's not really that quick, it's 35, 40-minute here, conversation of some of the general ideas from the volume. So we've got about 15 minutes left, I think, here. We wanted to open it up for anybody who's got questions or concerns or just generally interested.
Oh, sorry. Can you hear me now?
Yep, we can
Sorry
hear you.
about that. So, while the students are trying to figure out their so with this technology, if you could turn your mic off, it won't reverberate. There you go. Sorry about that. So, with the since neither you or Tony, as you said, are kind of boots on the ground kind of people, did you take into consideration when you were kind of creating the document and editing? I know you reached out to practitioners, but did you think about possibly bringing in a third member of the team that was a practitioner, if that would have any benefit?
So actually, Tony is a practitioner. So Tony spent a number of years. This is my interpretation of it. Tony spent. He spent 5 or 6 years actually in county level emergency management, and then moved from county level emergency management to consulting, where he works in direct action with agencies really up and down the East Coast here doing emergency management. So Tony is not an academic by the traditional sense, although he has a master's degree, and he's not a traditional kind of research-based academic. Most of his work is on his work history is in practice, and then in consulting for practice governance.
Yeah, I was thinking about like a more of a and I know Tony and yeah, Tony worked for Dauphin County for a while, but I was thinking more along the lines of somebody that's actually a responder. So maybe I phrased that wrong.
So when you say responder, do you mean like EMS kind of responder, or do you mean like a director of emergency management in an agency?
Yeah, I mean more of a director, somebody, and again, I know kind of Tony's background, what he did, somebody that's out there more response oriented, and not necessarily an EMS, but an emergency management response person, a little bit more maybe than Tony.
Sure, absolutely. I think so. I think, well, first off, I think probably if we were to have done that, we probably would have picked somebody more like a higher agency level. So the issue, I guess, is so response oriented for us really wouldn't have carried at all, right? Because many of the topics that we talked about are not exclusive to response, right? So they're really across the cycle. So it's preparedness, response, mitigation, right across the recovery. So someone who's just straight response oriented, I think. Wouldn't have. I don't know that it necessarily would have been the best choice for this volume. But what we did is but there might have been some changes, I think, in editing or in focus of editing. I think that what we tried to do again for the chapters themselves is we had a practitioner, someone who really was in an agency doing these kinds of things for each specific topic. We hope that they brought that through. We also had in the reviewers, the people that we were looking for on the practice side. So again, there was an academic reviewer and a practitioner reviewer. The practitioners were people that actually were doing it in agencies for that specific topic. So we tried to get the insight in. It's kind of hard to say. I mean, it is completely possible that there would be other insights and things that we might not have seen, or that somebody else might have seen differently if we had more directly integrated somebody who worked in an agency still. I definitely can't rule it out that they might have seen some things differently.
Yeah, I just thought of it because when you were saying that some of the groups that you paired with a practitioner and academic, that they, had a lot of back and forth. So again, maybe it would have been better synergy, or maybe it would have been worse. So just something to think of it.
Yeah, I definitely think there's some insights there. I mean, you know, it's yeah, it's definitely interesting. I think that there was conflict in some of the sections. Some of the people had good back and forth. I think some of them had less. I think it's interesting because some of it was driven by their views and worldviews. Some of it was also really personality driven. I think in a lot of instances, personalities had as much to do with it as the actual differences in people in the disciplines. Let's sort of that way.
All right, I'm opening it up since I'm taking all the time here. See if anybody else has any questions. All right, well, it is getting close to the top of the hour, and I know some of you have class and some other things to do. I want to thank Dr. Trainor for coming on and sharing his research, and obviously we'll be anxiously waiting. As many of you know, this is a topic we talk about a lot, the difference between the practitioners and the world of academia, and as has been clearly stated here today, there has to be changes moving forward from both sides. And as Dr. Trainor said, being down at EMI for the higher ed conference, you know, you get to see a little bit of that where you kind of had the great divide, but it's slowly coming together. So I want to thank Dr. Trainor, and unless somebody else has some questions for him, we will thank him and let him go. All right, it looks like I'm the only person that has questions. Sorry about that, but and Joe, I'm not sure if you know this or not, but we record all this because of being Friday afternoon. Some students obviously are working and cannot attend, and then our students will listen to this at a later time.
That's great, and I encourage if people come up with things. Sometimes this kind of setting is not really great for kind of conversation and questions. Feel free to email me. Email is listed right here on the last slide. So glad to take conversations on this, and I think that I'm also glad to take conversations or questions about other stuff as well. So any of the research-specific insights. Many of the students that are on here, UD, where I'm actually at, is not too far away. We've got a pretty extensive library that probably would be useful for many folks. So you guys are more than welcome to come visit our library. 50,000 books and articles on disaster science and emergency management. Also, we have a master's program and a Ph.D. program in disaster science and management down at the University of Delaware, not too far away, that might be of interest to some of the students too. So any interest or any questions about any of those kinds of things, feel free to email me.
All right, again, thank you very much. And we do keep your information up on our website so everybody knows how to get a hold of you, and they don't even have to look for the slides. Thanks, everybody. Everybody have a great weekend. For those of you riding tomorrow in the 20-mile charity ride, please pick me up. I'll be along the side of the road somewhere.